Hey guys, it's Dr. Ivy Branin here, Naturopathic Doctor in New York City. And today I'm really excited that this is going to be one of my first live interviews in a while. So I was doing a lot of live interviews with a variety of different wellness practitioners from Reiki, acupuncture, different mental health counselors before I had my son. And then we just got busy. And I'm so excited to be starting again. If this is your first time watching one of our videos or one of our bazillionth times, definitely don't forget to subscribe to the YouTube channel. Also, if you like this video, don't forget to like it. We will be taking some questions after the interview, but if you're watching this after the recording and you had a burning desire to ask something, you can, of course, feel free to put that in the chat. So I'm really excited for today's topic. So if you've watched a lot of my videos and some of my vlogs, I do talk a lot about herpes, HSV, more from a naturopathic holistic standpoint, but of course, like thinking about from the holistic standpoint, how does that have an impact on mental health? And does mental health also have an impact on herpes? And for this discussion, I'm really happy to have Melissa King. So Melissa King is a licensed mental health counselor who has specialized expertise in sexual health and helping individuals diagnosed with genital herpes. She is also passionate about working with people who struggle with self-esteem, dating, relationships, anxiety, depression, and faith-based or spiritual concerns. She is currently in advanced sex therapy training, which will enable her to assist patients with issues like low libido, desire, pain with sex, difficulty with orgasm, difficulty with condom use, and helping individuals increase pleasure in their relationships. She received her master's degree from St. John's University and has completed postgraduate training in eating disorders, compulsions and addictions, as well as interpersonal psychoanalytical psychotherapy at the Williams Allenson White Institute of Psychiatry, Psychoanalysis, and Psychology. She sees patients in person here in New York City, but also has virtual counseling for patients in California and Florida. All of her contact and links will be in the description of this video, but you can always learn more about her practice at myheartdances.com. So I'm so excited that Melissa is going to be one of our first guests of this series. So let's kick it off. First, you're like me in the sense that you had a lot of career shifts that got you to where you are now. So why don't we talk a little bit more about some of your background and what led you to become a mental health counselor, and maybe even talk a little about maybe what the difference of what does a mental health counselor mean?
Originally went to technical school for audio engineering. And I was good at it, but my colleagues were going home reading audio magazines, and I was not passionate or excited about what I was doing. And so I moved to New York City in 2001 to study dance, and that was my passion as a kid growing up. And I wanted to give myself a chance to do it. And while I was here studying dance, I had already been quite interested in healthy eating and organic food and whole foods and all that stuff. And so I ended up going just back to another program and did a certification in holistic health coaching. And at that time, I was also very interested in working with people who had herpes. So even back then, I started helping individuals with herpes work on their self-esteem and do healthy things for themselves. But I found that the coaching was very limiting. I really didn't get people start opening up to you and you find out there's so much going on. And I felt like I couldn't do all the things for my clients that I really wanted to do, and that's how I ended up going back to school for mental health counseling so that I could provide psychotherapy that I could treat depression and anxiety and get into the deeper inner workings of why people get stuck in life and have tools to help them through that and to help them move forward and not eat healthier, but also figure out what is, keeping them down.
We were connected, gosh, maybe 2014 or 2015. I think we're both in garden stages of our life. And one of the things that really attracted me to your practice was the focus on herpes. And you talked a little bit about that when you were talking about the career shift, but maybe even more so, maybe why is it important and why that's that specialization. I mean, it's amazing that through working from helping these patients from a natural perspective, but realizing that there was these mutations, and maybe just answer your question, so if it need to be better.
When I was a teenager, I had been diagnosed with herpes by a visual diagnosis. This was back in the 90s. And so there weren't very good tests back then. I went to some sort of doctor's office that had urgent clinic hours. I don't think it was called urgent care back then, and so I was able to get an appointment the same day. And I had like a lesion down in my genital area. And basically the doctor looked at it and said, it's herpes. And I said, are you sure? And he said 99% sure. And then I went to get a second opinion. I think it was the next day or 2 days later. And that doctor said, let me take a swab. Now we did have swabs back then, but we didn't have good blood tests. So the doctor did the swab and he said it could be anything. It could be a bug bite. It could be, who knows? The swab came back negative, but in my mind, I just thought it's herpes. It must be herpes. And so, because the other doctor seems so confident. And now, these days, the CDC even says you should not do visual diagnoses. If you have a suspicion of herpes, you have to back it up with a test, or you should back it up with a test. Because lots of things can present that look like herpes that aren't, or that don't look like herpes but is. Anyway, for the next 8 years, I lived as though I had herpes because most people don't have symptoms and many people have one outbreak and then don't have an outbreak again. So I just assumed I had it and I just wasn't having symptoms. And I was taking Valtrex. I was going to support groups. I was starting to tell friends, and eventually got to a point where basically everybody in my life knew that I had herpes. And then I was a teenager when this happened. And so I was abstinent after that for quite some time. And then the first person that I ended up telling, who I thought might be a new partner, was in my early 20s. And I told him, and he said, this is making me too happy to not be with you for something like that, which was such a wonderful experience to have for my first time disclosing. But what happened was I found out there were some new blood tests. And I thought, well, I'm going to go find out if I have type 1 or type 2. And that was the reason that I sought the blood tests. And so I went to this clinic that was offering the tests, and my type 2 came back negative right away. And I thought, oh, well, it must be type 1 then. But then when they called to give me the type 1 result, that was also negative. And so I was just really surprised because I had done so much work on myself to address the self-esteem issue. And I thought to myself, I really want to give back to this community that had been mine for so long and really help people to get their self-esteem back, because I had to work through these issues. And so as a coach, I started helping people with herpes to just start eating healthier. And I formed a support group for people with herpes. And then I think I mentioned earlier that I ended up feeling limited in all the ways that I could help people in their mental health. And that's when I went back to school to become a therapist.
So now let's get into some more of looking at herpes and mental health. In your experience, what effect does a herpes diagnosis have on mental health?
I feel like this isn't something that they thought they were really at risk for. And it's pretty surprising. Or they didn't think they were the type of person that gets herpes, but really herpes doesn't discriminate. I mean, like I said before, so many people, most people who have herpes don't even know they have it. And so it's really easy to contract it even in a monogamous relationship from a partner who had no idea that they were infected. And so when people come, they're feeling quite down. They're worried that nobody's ever going to love them. Am I ever going to have sex again? How am I going to tell people? There's a big stigma about herpes. And so people feel a lot of shame. And I think reaction or responses kind of vary between depressed mood to anxiety. And then sometimes people become very depressed or very anxious. And it's really important to help people kind of reconnect with who they are and all the other things that they bring to the world, to life, that are so valuable, and to help them recognize. I mean, I've been doing this now, working with people who have herpes for over 20 years. And so I think I'm in a unique situation where I've been able to see the vast majority of those people go on to live normally again, to live their lives normally, to have sex, to have relationships, to date, to go on to have families and have babies. And so I'm able to sit across from these people who are newly diagnosed and give a very realistic sense of hope.
You also had discussed in the past was not that it's exactly the same, but a condition like HPV, which can cause cervical dysplasia and abnormal paps. On the male side of things, have a test for males. Many men are carrying it and they don't know they have it. Then, depending on how often somebody's getting paps, they also may not know that they're carrying this virus either. And there can be this major stigma. So, I guess for somebody specifically who's really struggling with feelings of shame and worry, in your experience, how do you help these people? You don't want to say, get over these feelings, because we obviously are honoring anybody's feelings and then reactions towards any type of diagnosis or anything that they through. But how can we coping through these feelings?
What's been lost. There's almost like a sense of innocence and a sense of carefreeness there's often a loss. And especially for women, our sexuality is judged more harshly in society. And so just this idea that I'm dirty or whatever, I think it's really important to help people say these things out loud and to feel understood. And then I really try to let them know that hope is possible, and that the vast majority of the people that I've worked with have gone on to figure this out. And even though it doesn't feel that this way right now, this is a possibility for you. So I think I like to bookend it with on one side, having a space to get all the feelings out. And then on the other end to say, hey, there's a really good reason for hope. And then we go through a process. It takes people different amounts of time to heal from this. Some people are able to bounce back very quickly, and other people, it takes them a few years because maybe they already had other things going on that had affected their self-esteem or made them lose faith in romantic relationships that we may have to work through. I often find that the feelings about herpes are sort of usually the once we get past the initial pain, there's other stuff underneath that is sort of impacting how a person feels about themselves and about what's happened and about their hope for relationships. And so not only do we work on healing the pain associated with this diagnosis, but also what kind of relationships do you want to have? And are these the kinds of relationships you've been having? And if not, what can we do about it?
I guess because some of the things that you were saying, some people might get diagnosed with herpes and it's not a big deal. And they might feel comfortable disclosing to partners if they don't have this same sense of shame and guilt. Somebody else might carry that. And having also worked a lot with patients with herpes, some of them not even tell their husband that they have it, and rejecting sex in times of outbreak. One of the other things that I'm a little bit curious about, because when I am working with herpes patients, a big part is looking at the outbreak prevention, and then when somebody does have an outbreak, and there is such a connection between, and it's even the literature supports this, stress and herpes. And so I guess maybe talk a little bit about maybe how you help. What do you see as far as with your patients? Do you find that when there's a lot more emotional upheaval, that they're having more outbreaks, and how you support them during those times?
People will often notice that if they're going through a particularly long period of stress, that they're able to make the connection that I think this is why I'm getting an outbreak or whatever. The vast majority of my clients end up going on valacyclovir at some point, and I have found personally that it it's actually not doesn't just reduce outbreaks, but it actually helps people's mental health because it gives them some reason to feel, it gives them a way to feel in control of something so difficult to control, right? It's in your body. It's hard to be able to, don't outbreak now. So people often, when they're taking valacyclovir, which reduces outbreaks and also
Right.
reduces the risk of transmission by almost 50%, it tends to actually relieve stress, right? And worry. And there are some people that prefer to not take valacyclovir. And with those individuals, then we just need to work through other ways of reducing stress, which we would do anyway with anyone, whether it's coping tools, exercise, or mindfulness things, or breathing exercises, or changing some things. Often it means having to let go of something in the schedule that you might really wish you could keep.
In New York City, because there's this, you can't just have your 9 to 5 job. You also have to have your hobbies. You have to have friends. The list can go on, and there's children, and it's like you have to find that time to let thing go. Or I think also sometimes society puts a lot of pressure when, I don't know if it's the society puts us pressure on us, or we're choosing this pressure, but this specifically women and delegation, and you can't do it all sometimes. Sometimes whoever give that task to, however they do it, is good enough if it helps to free up some space and some time for something that's going to be helping to rebuild your patients. Do they talk a lot about transmission toward with partners, and how often is that even really an issue that's coming?
Like, once you get to the disclosure, well, but what if I transmit it to a partner, right? And the idea, it's such a scary idea for people. And, I think it's really important to work through, well, what if you do? Because I don't toss that to the side and say, oh, don't worry about it, because I think it's really important to sort of face the possibility that it could happen. And at the same time, again, I've been doing this work for over 20 years, and I don't really see a lot of people, or a lot of my patients, who report back to me transmitting. And that's not to say that it's not happening, or that it can't happen, or that some people just haven't told me about it. But the people who stay in touch with me, and I do have people who stay in touch with me because people come back, either they come back to therapy for new reasons, or they come back to speak at my group for women with herpes as a guest speaker. They tell me they haven't transmitted. And, those are people that are typically on valacyclovir as suppressive therapy. These are people who have typically had long-term relationships, or are in a long-term relationship and have stopped using condoms. So, education, I think being educated about the diagnosis and taking valacyclovir are very, very helpful for protecting partners. Now, again, many people with herpes don't know they have it. And so there's always the chance that a transmission's happened and their partner doesn't even know, because usually partners in long-term relationships, by that point, they're pretty relaxed about the fact that their partner is positive. But that doesn't mean that they're getting tested every time they go to the doctor or anything. People have generally had good experiences with this. I read a study once that showed that people who disclose to their partners are at less risk of transmitting. And I think that's probably has something to do with being open and honest, being able to talk to your partner about what's happening with your body, and for there to be open communication in the relationship. I think that goes a long way. Most of the people who work with me, who initially come for an initial diagnosis, contracted herpes from somebody that did not tell them they had it. whether it's because that person didn't know or whether it's because the person was hiding the information.
When is a good idea from a safety perspective? When is a good time to abstain from sexual activity? If you had an open communication already with your partner, they're going to be a lot more understanding versus, oh, they want to have intercourse with me. I don't want to kill the mood by saying, oh, it's a good time. Just go with it because why else? We're avoiding sex altogether. So I think having that open communication, it's funny. When we first decided to have this interview, I wasn't going to really take it in this direction, but now I'm kind of curious. What you? I'm not going to. We're not going to go so much to the medical treatments, whether natural or conventional. But I'm just kind of curious. The majority of the patients that you work with, are they taking acyclovir, valcyclovir, and have you noticed any difference between those that decide to go that route versus those that go the natural? And we're not going to get so much into specifics of the natural route, but I'm also curious about those that might, I guess either why they might not choose to do the conventional route, and then those that choose to, are they doing it alone or are they working with a patient, and if that makes any difference at all?
Never seen somebody have side effects from it. So people tolerate it very well. And it tends to make people feel better just because they feel, like I was saying earlier, they feel better. They feel like they are more in control, and it gives them some confidence in the reduced risk of transmission. I have had some people who've chosen not to take valcyclovir because that is their approach to life. They prefer to not take medications if at all possible. Some people don't take Valtrex because they don't like the reminder of taking a daily pill that they have herpes. And so that can have an effect on some people. And a few of those people have tried natural ways to reduce outbreaks, but usually it's stuff that they've found online. And they're doing it by themselves. They're trying to figure it out by themselves. And often people feel like, I think a very common one is taking lysine, even though we don't necessarily have good studies to show that that's effective. But that's something that sometimes makes people feel better, though, that makes them feel like, okay, I'm doing something for myself. But I've had people also, they've tried everything they've read online, they did it religiously, and they didn't feel like it made any impact. I haven't actually had anyone, I think, that has worked with somebody who might be more knowledgeable about how to improve the immune system or how it might help somebody manage their outbreak. So I don't really have an experience with how that might be effective for someone.
Exploring also some other causes that might be why somebody might be having the outbreaks. I have worked with some patients who are still having a lot of alcohol been on a Valtrex. So there's such but and definitely obviously anything else, buyer beware. There's some really terrible products out there, and you need to really do research if you are deciding to go at it on your own. So I was a little bit curious about your experience with that. And then when helping your patient be disclose their diagnosis with their partners, what have been some of the surprises that have occurred with that your patients might not have expected?
I think that people tend to be very surprised when they find a partner who's accepting, or find out that, I think rejection certainly happens. And I work with patients to think that through before, because it can happen. And just because often it doesn't happen doesn't mean that it won't happen, right? Like, we all get rejected. It's part of life for all kinds of reasons. But I feel like, in my experience, more often than not, partners are actually accepting. I think one of the things that I often work with patients on is remembering that just how valuable connection is. Connection and chemistry are really powerful things, and we don't find it with everyone. And so when we find it with somebody, whether it's a casual partner or whether it's somebody we might want to have a long-term relationship with, we tend to hang on and want to figure things out, like figure out the problems that come up that might prevent us from maintaining that connection. So I think that that's why so many acceptances do happen. And plus, different people have different levels of risk tolerance. And some people are really happy with the reduction at risk of risk that valacyclovir provides or that condoms provide. And life has risks. And I think that some people will do everything they can to prevent anything bad from happening. And other people are, I'm living my life, and this is a reasonable risk to me if we take these particular precautions.
This timing factor in? Like, when would you say, because obviously before someone has intercourse with a potential partner, but is there, because I would think also it's not even just whether this person wants to continue to see one, but also is this person trustworthy that they're not going to, because we also don't want everyone telling anyone our personal business. And that doesn't even have to be around, herpes. I mean, it could be anything from our past that we find private, but that would be important for us to discuss with someone. It's going to be our partner, specifically a long-term partner. So I don't know if there's like that magical, like, third date.
Interested in casual experiences, and so they might want to have sex with a partner on the first date, or maybe somebody that they've just met out at a bar or something like that. And I have watched people who wait for months right before sex, and they don't disclose to their partner until they feel sure that they want to proceed with a relationship. And I have also watched people who have met somebody at a club and wanted to go home with them and disclosed right away, because it wasn't about, do I trust this person? It was about, I need to communicate sexual health information. And I've watched people in both of those situations be successful with disclosure. So I don't think there's a magic number. I think it is much more about what's right for you and how do we work on disclosing in a way that feels authentic for you. As opposed to, a lot of people will come to me and say, I read online that I'm not supposed to cry and I'm supposed to be confident and all of these things. And it can be so much pressure. Of course, I want you to feel confident when you're disclosing, but it's not a requirement. You can be a human being. And I have had clients who've broken down crying during a disclosure that ended up going fine, meaning, well, maybe they didn't feel like they were fine, but they ended up having an accepting response. And I've had people who've disclosed confidently that didn't get an accepting response. I think that there's just a lot more involved in whether somebody's going to say yes or no. And I think it's so important for people to feel like they can be themselves, because we want to be ourselves in relationships with other people.
Can 100% be myself, who I'm with, can 100% be themselves. I will always like that, of course, and they might not always appreciate that about me, but at the same time, I feel like I can be pleased. Of course, obviously, but trust and all these other things, but it's definitely part of that.
Tolerate emotional expression, right? Who can be there for us when we're sad and not run away, right? And so I think there's something about being able to go into a disclosure with just some awareness that I deserve compassion.
Support group for women with herpes. Could you tell more about that?
But the group is ongoing. So a person can do the first 8 sessions, and then they can decide that was enough, or they can keep going. I've had people do the group for just 8 sessions. I've had people do the group for 2 years. It all depends on what you need and what you're getting out of the group. It's limited to 8 women. It tends to draw women in their 20s, 30s, and early 40s who are professionals in the city. And we spend time on education. We spend time working through feelings associated with disclosure and transmission and self-esteem and stigma and all of that stuff. And typically we also go into other mental health related and relationship related stuff, relationship patterns, which people often do want to work on, and other things that contribute to and impact self-esteem. Did I say the group, it does require a phone consultation and then an in-person screening before joining the group. And basically the fee works out to around $75 a session.
Would benefit from knowing about whether it's herpes and mental health or some other kind of ways that might be helpful.
Most important thing is that our sexuality it's normal. Being interested in exploring sex with a partner or partners is normal. People contract herpes from doing normal things. And I think it's something that I try, because sometimes people come in and they just feel so ashamed and they feel like, if I didn't do this, if I didn't do that. It's unfortunate. Some people do contract herpes in a situation that they didn't choose, like a violating experience or something like that. And that's different. But for many of the people that come to me, they contracted herpes in a very normal situation. They didn't do anything that everyone else isn't doing. And I think it's really important to just remember sexual behavior is normal. Of course, you're interested in sex. Of course, you need connection and touch in your life. And you didn't do anything wrong here. And also, of course, I think it's really important to use condoms to protect ourselves when we're in a situation that is maybe non-monogamous or with a new partner and we haven't gotten tested. However, research has shown we're not great at using condoms. And it's, so people sometimes will come in and they'll feel bad that they didn't use a condom with a particular partner. And by the way, you can contract herpes, condoms, so you can contract herpes even if you did use a condom. But sometimes people will feel really bad that they didn't. And I understand we all want to aim for our ideals, but I think it's really important for people to know it's not, you didn't do anything that's not normal. Lots of people are not using condoms in these situations. We're not very good at it. As much as I would love for us to be better at it, I think when people are in this kind of situation, they feel like I'm the only one that didn't use a condom in a situation where maybe I should have. And I want people to know that's not the case.
Yeah, I mean, it definitely is very common. And of course, also, it's not even just, when we think about condoms, also, it's not just about obviously preventing herpes, but other social infections, pregnancy. But yes, whether it's the heat of the moment, long size, all of the time. I know that we have sex in many schools, but even that I would say is probably lacking. And I think that there's still a lot of us. I'm not going to say, even though I am a naturopathic doctor, I wouldn't say I'm even expert in this area. But exactly as you're saying is that all the behaviors that one might have done to contract, probably the majority of us have been. It's that unfortunate luck of the draw. And then, of course, as we talked about before, that some people having each of these behaviors, they do have herpes. We actually don't even know that they have.
And then, so then when people get this in a long-term relationship, they're like, why haven't I been being tested for herpes? Nobody ever talked about it. And I do wish that doctors at least told their patients, hey, we don't include herpes in this test, and this is why. I think that would go a long way for just helping people to understand that herpes is a risk. It's out there in the world. I had a conversation with my doctor about it. Lots of people don't know they have it, and people aren't getting tested for it. So I mean, just that alone, I think would help a lot of people when they do get diagnosed, because I think the more that we hear the word and hear the reality before you end up getting it, it helps.
From their first sexual encounter or their partner that they've been with for multiple decades, and then other patients having multiple partners getting it, and then people that don't get it all and you have good kids. So I think it's really important to normalize. It doesn't necessarily need to be willy-nilly engaging in risky behavior, but just normalizing this a lot of people's experience.
And we're social beings, and we catch colds from each other, and we catch the flu from each other. And we, this is, it's, I think that, again, like you said, we want to protect ourselves in the ways that we can and the best that we can. But also this, I think that if we were talking about these things more as part of sort of being a human being and being in the world, it would really help to reduce the stigma.
I had a wonderful conversation with Melissa King all about mental health and herpes. Her contact and everything is in the description of this video. Her website is myheartdances.com. If you liked the video, please do not forget to like the video. Also, definitely subscribe to the YouTube channel. I have some really exciting interviews coming up in 2 weeks. I'm going to be interviewing Alexis Pace, who is a neurofeedback specialist, and we're going to be discussing women and ADHD. I'm also going to be talking to Dr. Reva Well, who is a pelvic floor therapist, in September, all about postpartum pelvic floor. Again, this is Dr. Ivy Branin of Simplicity Health Associates, and we are really looking forward to seeing you next time.